Okay, good morning. Today I'll be doing my presentation on the implementation of universal healthcare in the United States. So what is universal health coverage or healthcare? According to the World Health Organization, universal health coverage, UHC, means giving all people access to health services that they need when they need them without imposing financial hardship upon them. So UHC programs offer essential health services to include health promotion, preventative care, medical treatment, rehabilitation, palliative, and hospice care. So let's look at UHC on a global scale at the moment. All but 43 countries in the world provide free or universal health care to about 90% of their citizens. And of the top-ranked healthcare systems, all 10 of the top 10 countries use healthcare as the primary form of coverage. Why should we care as a country? At the moment, the U.S.'s healthcare spending, both per person and as a share of the GDP, continues to be far higher than in other high-income countries, and in fact, amongst all developed countries in the world at the moment. And yet, the U.S. still has the lowest life expectancy at birth and the highest death rates of avoidable or treatable diseases. In 2022, the Census Bureau calculated that about 7.9% of our citizens did not have health insurance in any form, which doesn't sound like a huge number, but that amounts to about 26 million people. So let's take a look at our current healthcare model or health insurance model. So there are currently 3 different ways that we can get health insurance or health care. The first being everything's out of pocket. We pay for every aspect of a doctor's visit, and that can get really expensive. The second being individual or employment private insurance. Individual patients either pay for their own premium, their own private insurance, or they get private insurance through their employer. This isn't great either. Private insurance rates are pretty expensive. On average, in 2003, for an individual premium, you'd pay on average about $8,500 a year. And for a family plan of 4, you're paying up to $25,000 a year, which is crazy. And even if you're getting it through your job, it tends to influence, your decision to stay at a job or put up with things that you probably wouldn't otherwise because you have a family and you need the insurance or something like that. So it plays a huge part. It really influences, your life and your decisions. And the third way that we are currently getting health care and health insurance is through government financing, government-funded programs such as Medicaid, Medicare, and the Veterans Affairs programs. So a couple challenges that we face as we try to implement UHC. There are more, of course, but these are the 2 that I came up with. The first being that the U.S. is an uber-capitalist country. You don't have a lot of support, especially from private insurance companies, to adopt state-funded or government-funded healthcare systems because, you're taking money out of their pocket. Excuse me. The second challenge being that the U.S. is just large. We're a really, really big country, and it's really hard to implement like a federally funded, healthcare program all at once. But we have been taking steps in the right direction, especially on, a statewide scale, I guess. States like Oregon have implemented like the Oregon Healthcare Plan, which is a medical assistance program that covers people from all walks of life. I think the state of Washington started offering public options back in 2019. A couple other states are following suit. And Representative Ro Khanna of California introduced a bill that will provide states with federal funding streams to help them implement state-based healthcare programs. It was originally introduced in 2001, and I believe he reintroduced it in 2023. So what can we do? There are two actions that we could do to support state-based funding. We could either call our House representative or email them and their aides asking them to support state-based universal healthcare systems. Yep, and that is all I have for you. Protect affordable healthcare.